Hey everyone, happy Monday and happy New Year. I'm excited to do our update just on Monday this week because of short week with our holiday and everything. And speaking of holiday, I just wanted to give an extra special thank you to those who signed up early to work New Year's Eve and New Year's Day. You are so appreciated so that the rest of our team can have a day off of rest to celebrate with their families. And as a reward, we are going to have a lunch provided for you tomorrow. It'll be here all day, so no matter the shift, you can help yourself. And that's just a little something special from my family to you as an appreciation for, again, working that holiday and sacrificing your time. So one exciting new feature that we have in AVImark is that we can actually now print prescriptions to be sent to outside pharmacies straight from our drug label in AVImark. So the way to do this is you enter a drug label just like you would always once you enter your item and you create a drug label. Instead of printing it to the label, if you're actually going to be filling it to an outside pharmacy, you would just note that on the drug label, and then in the bottom of the screen, instead of just choosing print, choose print document, and then you can have the doctor sign it. You can test it out if you want to in our hospital record a couple times to get it going. Again, you enter your item, you create a drug label. In the drug label, you print filling to and their choice pharmacy, and you click print document and have the doctor sign it. Right now, what we've been doing is we use our prescription label pads and we just put the label on the pad. But this is really costly and kind of wasteful sometimes. So now we have this document system that we will, you can start using it immediately, and you can definitely go to exclusively using it by the time we want to run out of prescription pads, which should not be too much longer. If you need tutorials, you can see myself or Alex or Danielle. We're happy to help you do that. Again, this would be how you print a prescription to go to an outside pharmacy. Print document, have the doctor actually sign the document, and then you can send it on out the door. Really exciting. Also, something that we've been kind of struggling with for a while now is, I know everybody who's been here for a while knows the intensity of our caseload has changed a bit, and certainly the types of patients that we're caring for. We're having a lot of pretty gruesome cases and a lot more patients in the hospital at any given time. And although this is awesome and great for business and great for us to develop as a team, it makes it really hard for us to have guests in our working space. So I wanted to remind everybody what we've done for a long time is we allow students, kind of job shadowers, externs, and so on to come into our working environment, sometimes for a few hours, a few days, a few months, whatever. We are no longer going to be able to do this. Each one that comes, we really give it our best, but our team has to remain dedicated to our patients. Our doctors are busy, and again, with our workspaces crowded, we feel like this has become a bit of a distraction to our patient care. So how this affects us is right now, everybody has just been kind of funneling those messages to Danielle to deal with, but it's becoming overwhelming to her. And I think sometimes it's misleading to the caller who's trying to set something up with us, that I'd rather our customer care team or whoever's answering the phone just go ahead and share with a student, volunteer, job shadower, extern, whatever they're presenting themselves as, that's not something that we do. We do it for veterinary students with LSU who are actually in a preceptor type program. We have a contract set up with them, but we don't do it for anyone else. So if it's a veterinary student, you can leave a work list for myself or Dr. Patrick, and we will get that set up for them. Otherwise, I think it's most appropriate to just be honest and tell them the truth, that because of our working environment, because of our hours, and because of our caseload, we're not able to take job shadows at this time, and we'll definitely let the public know if that changes. And you might consider referring them to a shelter or to a smaller practice if they're looking for somewhere to go instead of just turning them away. But the main message from me to you now is that we're not going to be able to continue doing this into the future unless it's something that we offer someone by special arrangement, which we don't have plans to do because of all the reasons I said before. The next thing that I wanted to share, Alex did a great job of putting it out in a Slack message late last week and making sure that everybody has them, but we are instituting parking passes. They are really easy to use. You're going to take this small pass. I'm going to get you one to show you right now. You're going to take the small pass like this, put it right above your inspection sticker. That's going to be on the driver's side of your car, the lower left-hand corner. Just above your inspection sticker, you can put this on. It'll show from the outside so that we can see that your car is supposed to be in our lot. We've given everybody 2 in a little envelope like this. That way you can have one for yourself and one for a guest. That would maybe be your significant other, or if you have a family member's car that you occasionally drive or that occasionally parks here, you can use them for those. We also will have little little rear view mirror tags that you would use if you have like a rental car or something like that. You'll just have to be responsible enough to remember to get those, and we will be generous in reminding you about that in the future. I'd like everybody to have these put on their cars by Wednesday. We're putting up towing signs in our gravel lot so that we can begin conditioning our neighboring businesses to not use our lot. And then I think towing will start probably the week that the 14th falls on. That we're going to be pretty aggressive over that because we need every space in our lot, and we don't want the liability of outside parking occurring in our space. So make sure that you have that tag up. Occasionally we have a client who will say, hey, can I leave my car here for a couple of hours? That's fine. I'm going to have those rear view mirror hanging tags up at the front desk so that you guys can help yourselves to them on the occasion that you need them, and that also if we have a client who's going to leave their vehicle unattended, that they would have those there. Pretty easy to use, and I'm here for questions as you come to them. Don't forget to start using that prescription feature immediately because we are almost out of pads, and I want to make sure that everybody learns it before then. I hope you have a happy and safe new year. Again, thanks for all who are working that day. We appreciate you and all of you every day. Have a great one.